everyone. We are so glad you can join us today for our webinar. Prior to beginning, we'd like to review some items with you all. You have been placed on mute upon entering the webinar, and if you would like to engage with our speakers today, please place any questions you may have into the Q&A box located at the bottom of your screen. There will be multiple times throughout this webinar where we will do our best to answer your questions. We will record the webinar today, and we do intend to send out a copy of the recording to the registered participants in the next few days. We will also plan to post the recording on the Foundation for Healthcare Quality's YouTube channel. My name is Emily Robson. I use she, her pronouns, and I am the Transformation and Community Partnership Manager at the Foundation for Healthcare Quality. I would like to welcome you all to the Our Climate's Impact on Health, Acting Now for a Resilient Future webinar. As we begin, I'd like to take a moment and recognize I'm speaking from the unceded land of the Duwamish tribe. We acknowledge the Native people, past, future, and present, who have cultivated the land within Washington State, their knowledge and practices that support the health of people, animals, plants, and land in our area. We recognize Native people have taken care of and honored this land for many generations. Today, we'll be exploring the impacts of climate change within Washington State. We heard from our BREE members the desire to know more about this topic, how the healthcare system may contribute to it, and what can we do to build resiliency and prevent further harm for ourselves, the land, and generations to come. In this webinar, we intend to define key terminology, explain current impacts of climate change within the state, describe actions individuals and organizations may take to build climate resiliency, and identify some resources to support promoting our climate's health. The Foundation for Healthcare Quality and the program, the BREE Collaborative, are very excited to have you all join us and hear from our speakers today. Our speakers are Cunningham from the Washington State Department of Health, Dr. Chen from Washington State Healthcare Authority, and Kramer and Colin Rhodes from the Climate and Health Equity Initiative at Public Health Seattle-King County. We will have time for each of our speakers to present, and after the presenter, there'll be a few minutes for Q&A. After each speaker is presented, we'll then hold the panelist discussion. If you have any broader questions for our panelists about information related to climate resiliency or climate action, please place those questions for our speakers or those broader questions for the entire panel into the Q&A box. Our staff will be monitoring as the webinar continues. Now I'll pass it on to Cunningham to provide an introduction to climate change and discuss the work he is leading at Washington State DOH. Rad?
Thank you, Emily. And could you please give me a 5-minute warning when I'm getting close to the end of my time here?
Yeah, I will.
I want to make sure I give the other speakers enough time. So my name is Cunningham, and I work at the Washington State Department of Health, and I manage our climate and health section that was formed in 2019, right before the start of the pandemic. So we've had a bit of a rocky start, but we're really starting to get some traction. And I'm excited to talk a little bit about what we're doing at DOH and some of the priorities and some of the ways we think about climate change and how it impacts health. Next slide, please. So I'm going to talk about climate change, structural racism, environmental justice, and climate justice. And so if you're wondering how we approach climate change at DOH, that's how we do it. And so wanted to start out with some definitions. So just overarching, climate change is the change in average conditions over time. So it's not like, this year and next year, those are all influenced by, meteorological events that have been going on, but it's the change in temperatures over decades and multiple decades and centuries. And so climate change is not the forecast. So just because it's hot somewhere or cold somewhere else doesn't mean that climate change is or is not happening. And then environmental justice, I took this definition from the EPA, but there are lots of definitions of environmental justice. And I chose the EPA definition because it influenced the HEAL Act, which is an environmental justice law in Washington State. So environmental justice is the fair treatment and meaningful involvement of all people, regardless of race, color, national origin, or income, with respect to the development, implementation, and enforcement of environmental laws, regulations, and policies. And I'm not gonna read everything just to save a little bit of time. But climate justice, this I took from our own webpage. I really have a lot of respect for our climate justice coordinator, and this is how she phrased it for us, and I like it. And so the climate justice is focused on addressing unequal impacts of climate change by prioritizing health and safety for those who face the greatest risk as we prepare for and recover from climate events. And so when you're thinking about climate justice, thinking about who, when you're thinking about a wildfire smoke event or a high heat event, who is going to be more impacted in your community? Who are the vulnerable folks? Who are the people who work outside or live outside or have conditions in their homes or schools or other facilities where they can't get cool or can't have access to clean air? Those are the populations that we're interested in focusing on first when we're addressing climate change and health impacts. Then climate resilience, just the ability to prepare for, recover from, and adapt to the impacts of climate change. So a very simple answer to a very challenging problem. And then health co-benefits. So health co-benefits are benefits to the population from policies that are designed to reduce greenhouse gas emissions. So we might, the coal plant in Centralia is going to be shut down to help us meet our clean energy transformation targets. But the co-benefit of the improved air quality in the Centralia region is going to have a lot of health benefits that weren't really the intent of the policy, but they're a byproduct of it that's valuable. And the nice thing about health co-benefits is that you don't have to believe in climate change to see the benefit in the health co-benefit. So there's often opportunity for finding middle ground amongst people who have a variety of views on climate change. Next slide. So when I think about climate change, and this is kind of the theme of how I approach the work and how we approach climate change at the Department of Health, is that when we are thinking about what we need to change to adapt to climate change, our transportation systems need to change, our buildings need to change, our energy systems need to change, and I would argue that our health systems need to change. And as we are changing all those things, that you can think about it as like a burden to have to change from the status quo, but I think of it instead as an opportunity that as we are changing those things, we have an opportunity to right the wrongs of the past. And that's what these next set of slides are going to be about. So, could you go? Yeah, so when I'm talking about environmental justice, I'm seeing it go back and forth between.
Yeah, I'm sorry. I'm trying to get it on the slide you want, and it automatically goes to the next one. So I apologize for that.
Well, that's okay. Let's just leave it here. And I just want to say environmental justice issues have been, in the original civil rights movement was, when I had climate justice originally explained to me, was that the original civil rights movement was, a climate justice, it was an environmental justice movement and a social justice movement. They were paired. They were the same thing. A lot of the protests were about, Martin Luther King was in Montgomery, Alabama for a sanitarian protest. So that it just kind of demonstrates the link between those two movements. And then as time went on, there was sort of in the 70s and 80s, there was a separation between the social justice movements and the environmental movements. And so you sort of had the Sierra Clubs and that sort of environmental movement emerging. And so the two movements kind of separated. And I've heard the environmental justice movement described as the reintegration of those two movements. So when I think about environmental justice and structural racism, I really like looking at this redlining and air quality map. So you're probably all familiar with redlining, which was a process where banks kind of chose where they were going to, how they were going to qualify different mortgage products based on, in part, race, as sort of like as a way of, they were calling it neighborhood quality, but they were measuring neighborhood quality in terms of racial diversity. And they ranked neighborhoods A, B, C, and D. A is was the best for them, and D was the worst. And what you can see is that even today, even today, years and years after, practices like redlining have been illegal, you can see the air quality is, measurably worse in the communities that were originally redlined. So we're living in a world where the environmental exposures are shaped by some of these racist and structurally racist policies of our past. And so there is still work to be done to undo the structural harms that we've done. When we're thinking about environmental justice, and we're thinking about the opportunity of the things that we can improve on, and the public value we can create as we adapt to climate change. Next slide. And this is just a few maps of linking those air quality, redlining and air quality issues to asthma rates. So the top maps are redlining in certain cities. So pick one map that you want to look at, maybe a city you're familiar with, and look at the red areas of the map, the areas that were marked as undesirable in the redlining process. Then look down at the bottom map, which is emergency department visit rates for asthma, and see how they line up. And I think you can see, especially in, San Francisco and San Diego, that there is still, a link between, the historical redlining, which links to the air quality, which links to our asthma hospitalizations. And so we're still, the healthcare services we provide today are influenced by some of these structurally racist policies of our past that are still influencing how our cities operate today. So next slide. And you see the same association when you're looking at heat. So if you're looking at land surface temperatures on the left side, you're looking at land surface temperatures. So that's how warm it is in different parts of the city. So these are the same cities during the same time. And you can see that the cities that were ranked D are hotter. So when you're talking about a high heat event, extreme weather, that there's a big difference between the neighborhoods that were ranked A originally by the redlining agencies and the ones that were ranked D. And then on the right side, you see tree canopy. So you see the opposite effect, that the highly ranked neighborhoods or the wider neighborhoods had more tree canopy today, even still today, as part of the history of this policy. So that's just one structurally racist issue amongst many that are influencing how environmental exposures are unequally distributed based on things that have nothing to do with personal choice. Next slide. This is a quote from a covenant on a property in the city of Seattle. And so these sorts of racist covenants were allowable and still exist on many deeds, even though they're no longer enforceable. There's histories of them, of attempts to enforce them up into the 70s. And so on this particular one, it said, no race or nationality other than the white race shall use or occupy any building on any lot, except that this covenant shall not prevent occupancy by domestic servants of a different race or nationality employed by an owner or tenant. So, the Fair Housing Act made the enforcement of this illegal, but the Fair Housing Act is not that old, and so the impact of these policies are still being felt today. So that's kind of why, when I'm thinking about climate change and who is most vulnerable, that a lot of it is influenced by our past and how we've designed our cities. So next slide. And so we've worked together with, I've worked with the Washington Tracking Network. They're a great team, and they built something called the Environmental Health Disparities Map. And this map has become really influential from a policy perspective in Washington State. And one of the big reasons that it became so influential is because instead of just building the map using just getting a bunch of nerds together to try and map out environmental health vulnerabilities. They did a 2-year process where they engaged with communities and listening sessions and tried to walk along with the communities and learn from them as they were designing the map. And that process, that community engagement process, I think really lent to the power of the map. Next slide. And the way the map is set up is with the theory of, threat times vulnerability equals risk. So risk is that score you see displayed. So sort of the shading on that last map is the risk. And the threats are things like fossil fuel, pollution exposure, other toxic exposures, socioeconomic factors, and sensitive populations. So next slide. And what we see, so what that map does is it ranks every census tract in Washington on a scale from 1 to 10, from the least environmental health disparities to the most. And one of the things I did when evaluating the map was look at life expectancy compared to environmental health disparities ranking. And you see a pretty clear pattern that, if you live in a census tract with a environmental health disparity ranking of 1, your life expectancy is about 2 years longer. And if you live in a census tract with a ranking of 10, your life is more than 3 years shorter. So there's a 5+ year difference in life expectancy between the 1s and the 10s. Next slide. And I found this particularly devastating, but you can see a clear trend in the percentage of white population versus non-white populations in the census tract. So you've seen the environmental health exposures are primarily born, or not primarily born, but they're born to a large extent or disproportionately by communities of color. Next slide. So one example of this is the flooding in the Duwamish. So I'm not sure if folks on the call remember, but a few months ago, there was a king tide that coincided with with an atmospheric river that caused a lot of riverine flooding, meeting a king tide, and overwhelmed the dike and flooded the South Park area of South Seattle. And so redlining is part of the process that drove the demographics along the Duwamish River to be predominantly non-white. So that was a structural racism issue. The racist planning policies cited industrial pollution sources near the neighborhood. So that's an environmental justice example. And then climate change induced sea level rise and heavy rains combined to flood the neighborhood. And so that's climate injustice. So that's just that's one example where you can see kind of examples of how all three of these fit together: structural racism, environmental injustice, and climate injustice. Next slide. So I see this as an urgent need to lead with climate justice. So that's issues like that are why we take the approach that we do when we're thinking about how we are going to do our climate and health programming. So climate change adds to existing health inequities in communities and populations least responsible for the climate crisis. And drivers of climate inequities in the US are racism and discrimination, environmental injustices, poverty, high-risk occupations, pre-existing health needs, and limited English proficiency. Next slide. So transition is inevitable, justice is not. So we are going to have a changing climate, and we are going to adapt to it. But the way that we do that is still up to us. And meaningful and community engagement is the path to having a just transition. So that community engagement process that we all do to different extents in our different organizations is the way that we can learn and adjust and adapt when we're trying to design systems and processes that are going to serve people equally. Next slide. So I've got a few big picture climate change slides that I borrowed from my colleague Jeremy Hess at the University of Washington. Next slide. And so there's some reason for hope, at least in our region, because we had a really remarkable year with some notable activities. So there was the AR6 and COP27, which are like international climate conferences. And nationally in the US, we passed the Inflation Reduction Act. In Canada, passed the 2030 emissions plan, which sets North America up on a pathway that's closer to limiting us to 2 degrees of warming. And regionally in Washington, we have passed the Climate Commitment Act, the HEAL Act, and the BC Clean Roadmap. And so in just 1 year, the vision for what we expect in terms of climate change for our region and for the world has gotten better. It doesn't mean that we have made the transition that we need to make, but we have made progress towards it. And there's a lot to be hopeful for. And so we've got, later on, I'll show you the 10 insights for implications for our region. And and this was for the Cascadia conference, which was a conference of environmental health professionals that happened earlier this year. So next slide. So I'm sure you've all seen charts like this before. Our observed weather patterns have varied significantly from the modeled weather patterns that we would expect in the absence of climate change. So sort of that orange-ish, beige-ish line showing an increase in temperatures is what we have observed. And then the bluish line is what we would have expected in the absence of human activity. And this change is going to have impacts on things like infectious disease, malnutrition, mental health, and displacement on a global scale. Next slide.
Hey, Rad, we have about 5 minutes left.
Okay, thank you. Yeah, I'm gonna skip through a few of the basic climate change slides. We'll go back to that last one. That's gonna be the last one I'm going to cover. So we have our warming projection. We are at where the black line meets the multicolored lines, and so we have some choices to make about our future in terms of how much climate change we are going to experience. And so what I see when I look at this is there is a gap between when people talk about we need to limit it to 1.5 degrees of warming, well, we're close to 1.5 degrees of warming anyway. So I understand the reason we want to design policies to meet that 1.5 degree target, but it's unreasonable. And when I see researchers projecting future climate scenarios, they're not using that 1.5 degree scenario because they think it's unlikely. They use RCP 4.5 and 8.5, which were the higher emission scenarios. So, setting the policies like the Climate Commitment Act and the Inflation Reduction Act are important in terms of reducing our emissions, but we have demonstrated in the past that we don't always meet our emissions targets when we have these plans like that. So there's a lot of uncertainty and a lot of challenge going forward in terms of what we can do when we're trying to reduce the impacts of climate change. So could you go to the let's see what DOH is doing. So few highlights around what we're working on at DOH. So one thing is wildfire smoke. So the wildfire smoke seasons are getting longer and more severe. And so we're doing things like portable HEPA air cleaner distributions, public health guidance around when the recess needs to be inside, when you need to close the school, when you need to cancel the practice, when you need to shut the rodeo, which is a very a contentious call to make, and which is done by our local health officers, but with guidance from my air quality team. And we're increasing our focus on indoor air quality because I bet you're all inside, breathing inside air, and that's what the air that most people are breathing. And that's when you're looking at health impacts, the air that to some extent matters the most. So how do you keep those indoor air spaces clean? Next slide. So one thing we did to think about how you keep those indoor air spaces clean is we recruited some participants in Eastern Washington to put air cleaners in their home and air monitors in their home so we could understand what the infiltration of wildfire smoke looks like. So if you look at participant 1, that top line is the outside air. The middle line is their home, is inside their house. And then that bottom line is inside their house in the room that they had their air cleaner running in. So you can kind of see there's kind of these tiers of risk. So you've got sort of the high risk ambient air, the moderate risk indoor air, and the low risk clean air room air. And that's participant 1. Then you can see some of the other participants, it gets a little bit interesting. So participant 3 is a smoker. So you can see the indoor air gets worse than the outdoor air when they're taking their, during times when they're smoking. And so trying to figure out, how are these interventions working in the real world has been a challenge. And that's just inside the homes. We also need to understand how this works in schools and long-term care facilities and other facilities that serve high-risk populations. Next. So it makes public health guidance challenging because this is sort of, my, when you have COVID, you have to open the windows to get more ventilation, but then during wildfire smoke, you have to close the windows to keep the wildfire smoke out. And then you have to open the window again because of the high heat events. And then what if you have all three at the same time, like we did during the 2021 heat dome? And so the public health guidance can get tricky. I'm not going to go through our recommendations here, but that's kind of what we're trying to manage when we're trying to help people understand how to operate their existing buildings with their existing tools during these different types of events. Next slide. So we did some partnerships with counties on some interventions. So in King County, we worked with them on their indoor air and homeless shelters and DIY box fan distributions. In Pierce County, we worked with indoor air on childcare centers and portable HEPA air filter distributions to those childcare centers. And in Kittitas County, we did the residential indoor air study that you saw some data from. And are working on long-term care facilities in indoor air and have done portable air filter distribution. So that's kind of been how some of the ways that we're piloting how to do these air quality interventions, and we really are working towards turning those pilots into statewide services. Next slide.
Hey, Rod, we were hoping to do some Q&A with you.
Sure.
Is there a few comments you want to make on the other slides before I ask you a question?
Yeah. Could you advance just so maybe someone in the Q&A can tell me what that spike is. So this is a chart of daily deaths minus COVID deaths. So this is like COVID taken out. What is that spike right there?
Is it the answer on the next page?
Yes. It was the heat dome. So heat is another issue that we're not as far along in our heat adaptations. I'll just say we're the furthest along in ambient and indoor air and wildfire smoke interventions. And then we have some other issues we're working on, like heat, harmful algal blooms, pollen monitoring. And so that's all I have to say. I'm ready to take some questions.
Thank you. Yeah, somebody did say heat dome in the Q&A as well. We did get a question that says, one of the most important aspects of resilience is to disasters is really strengthening connections between public health agencies and civic and religious organizations. How is the DOH supporting these types of bottom-up effects?
Yeah, so I think climate change is by far the most interdisciplinary thing I have ever worked on because it touches everything. And so those partnerships are necessary. And I'll say that, in my time at Department of Health, I haven't seen a lot of examples of really effective partnerships with religious organizations. And I don't know why that is, but it's something that I'm interested in. But the partnerships we are working on developing are like between our other state agencies and our other federal agencies that operate in this region, so that we can work together and figure out what opportunities we can provide to local communities as a sort of government family that serves the Northwest. So we created this group called CHI, which is the Climate and Health Adaptation Initiative. And it has a couple, a variety of state agencies and a variety of federal agencies. And we got a lot of support from the Federal Reserve Bank of San Francisco in setting that up. And it's the first time a bank has ever reached out to us about doing public health work. And they're like, why are you here? And it has been a great process of learning about some of the shared interests we had with these other partners on climate adaptation and resilience.
Thank you. And then we have one more question. Was somebody said that they read, since we have defrosted too much, that there's no way that our warming can stabilize, like CO2 can't be absorbed. They're curious what your thoughts are on this.
I've
sorry, deforested too much, not
deforested. There are, so I'm not, this is a better question for like Nick Bond or some of the climate specialists, but what I have seen in the climate literature is that there are some like positive reinforcing cycles, sort of like the ice melts, so it reflects less heat, so that more ice melts, so it reflects even less heat, so more ice it melts, and it sort of sets off this cycle where the warming is continues, and regardless of what humans are doing on the planet, because you kind of have lost that battle. And so those are theorized, and some people think that they might happen. And there's some good literature if you feel like you have a strong mental fortitude to look into like the doom version of our future. There's some good papers on what, you know, the worst climate scenarios might look like from a public health and climate perspective. And so I've read a few of those. They're pretty interesting, and I've wanted to do like a doom presentation about what is in there, like what it could really look like. But I don't think that that's always the most helpful.
Thank you for letting us know about those resources. And thank you, Rad, for presenting. We'll hear back from you in a little bit, but now we'll invite Dr. Chris Chen from the HCA to speak.
Thank you so much.
Great. Thanks, Rad. Really look forward to some of those doom presentations in the future. And hi, everyone. I'm Chris Chen. I work as a medical director for Medicaid at the Washington State Healthcare Authority. I'm here today to talk to you a little bit about climate change and health and healthcare. And so really appreciate the Foundation for Healthcare Quality putting this this talk together, and see a lot of familiar faces in the audience. And so look forward to the Q&A portion as well. So next slide, please. So just in case folks aren't as familiar with the Healthcare Authority, just as an introduction, we wear a lot of different hats at the Healthcare Authority. We're a public purchaser, we're a Medicaid agency, we're a behavioral health agency. We're also focused on health IT initiatives, and through the public purchaser and Medicaid agency roles, we purchase healthcare for more than 2.5 million Washingtonians through our Medicaid program, which is currently has about 2.1 million Washingtonians enrolled, as well as our public employees and school employees program. Our mission as an agency is to achieve a healthier Washington by providing high quality healthcare through innovative health policies and purchasing strategies. And I just want to share some of our values as an agency, because they really do align with what we've talked about today and so far, and what we will continue talking about: putting people first, really putting diversity and inclusion and health equity front and center in our work, as well as innovating in public policies and health policies, and all with a very strong focus on stewardship of scarce resources. And we know that in healthcare, there are many scarce resources. Through the pandemic, I think a lot of people became familiar with shortages on COVID tests and COVID vaccines. And the reality is we're kind of constantly pushing the bounds of sustainability in healthcare because we have so much waste in the system. Next slide. So our approach to healthcare purchasing to achieve those different values are by transforming care, getting better health and better care at a lower cost, supporting whole person care, integrating physical and behavioral health services, as well as using data-informed evidence to make purchasing decisions. And there's a slide here on the triple aim. I mean, there's a picture here on the triple aim with the emphasis on improved population health, which is changing as climate change evolves. And Rad kind of shared with you all the devastating impacts of increased heat waves, increased droughts, wildfire smoke that are being felt across the country as well as in our own backyard. We really strive to be thinking about how climate change is going to be affecting the health of the individuals that we cover, and how we can go about improving the quality of care and patient experience and lowering cost of care through those different initiatives. Next slide. So just a little bit of a focus on sustainability. I think over the last decade or so, healthcare has really kind of woken up, and many of you guys are familiar with these concepts on the impacts of social determinants on human health. And when we think about climate change and health, we recognize that climate change really is the ultimate driver of social determinants of health, there is significant unsustainability of our current healthcare environment. So I think one of the things that is really thought-provoking about climate change is it really makes you take a big step back. And so, oftentimes in our day-to-day work, whether we're based at providers or payers or in the community, we can really just tend to focus on our narrow scope of work. But when you kind of pull back on climate change, you think not just about your region, not just about your country, but really about the whole world. And I think it's really kind of striking when you think about the fact that the United States represents only about 4% of the global population, with the 350 million people that live in the United States. But we account for over 50% of the global healthcare expenditures. And this is not sustainable. We have been approaching over 18–19% of the GDP, and that just can't continue. Our whole entire economy can't be dedicated to healthcare. And all of that has a carbon footprint and is associated waste. And there's been lots of documentation about the different sources of waste in our healthcare system, including unnecessary procedures, unnecessary diagnostics, unnecessary administrative burden, and significant efficiencies that could be attained by standardization. And we all know that we don't achieve the health outcomes that we should for the money that we invest. And as it pertains to climate change, we know that low-income individuals, also those who are more likely to be covered by Medicaid, are more likely to reside in urban heat islands, be more exposed to air pollution, be unable to manage unexpected out-of-pocket expense. And so we really appreciate the Department of Health and King County's initiatives and air filter pilots, because when the wildfire smoke rolls into a region, someone who can't handle an unexpected $400 expense, it's a lot harder to just go to Home Depot and buy an air filter or air conditioner or stay a night in the hotel. And we know that negatively impacts their health. Next slide. And so what are things going on at the Healthcare Authority to address all of this? I just want to start off. The Healthcare Authority is really interested in addressing our own carbon footprint. There's, for those of you who are familiar with climate change work, very prevalent framework around accountability includes Scope 1, Scope 2, and Scope 3 emissions. And we've been focusing on our Scope 1 and Scope 2 emissions for some time along the lines of purchasing and procurement. And so our purchase services unit does abide by the Washington State Green Purchasing Guidelines, which aims to procure supplies that are more environmentally sustainable than conventional supplies. COVID, of course, has facilitated a significant transition to telework, and that has led to a facility consolidation, which results at least in decreased energy usage by the agency itself. There's transportation initiatives going on at the agency to support charging and electric vehicle fleets, as well as coordinating with other state agency work. And we really are very, very fortunate to be working in a state that really puts climate change front and center, and the State Environmental Energy Office coordinates work between Commerce and Ecology, Department of Health, DSHS, and the Healthcare Authority is really excited about being able to participate in some initiatives and collaborating with the Department of Health as well. On the next slide. So another initiative that I'd like to highlight is just kind of ongoing work at data analysis. Unfortunately, we weren't able to kind of develop things in time to share with you today. But as I mentioned, low-income folks we know are going to be much more vulnerable to the effects of climate change. We know that Medicaid folks are where we hypothesize that they're more likely going to be exposed. But we need to perform those data analyses to kind of solidify those linkages. And so there is a potential, payers and purchasers broadly have lots and lots of data. And at Healthcare Authority, we think that we can use some of that data to identify vulnerabilities, assessments of our clients, and understand the health impacts of climate change. And just to kind of bring it home a little bit, some examples of efforts that use Medicaid or claims data locally are the OFM on the right side here. OFM kind of partnered with the Department of Ecology using the all-payer claims database and performed some health services research that showed that there was a significant association of asthma medical claims with wildfire smoke up to about 14 days following the exposure. And this was a really interesting study that kind of paired air quality indices with claims data. On the left-hand side, a little bit more broadly, nationally, Mathematica has developed an interesting climate watch tool using Medicaid TMSIS data to look at healthcare utilization for heat-related illnesses, among others. I think they're going to be updating their tool in the near future to document associations with other adverse effects of climate change. So data is a really kind of big area that we're interested in exploring. On the next slide, the Healthcare Authority has long had a commitment to addressing health-related social needs, and I think even Medicaid has broadly as a program has had significant roots in addressing health-related social needs. including back in the 1960s and inception of the program. Medical transportation, for example, has been incorporated since early on. And so under the Washington State Medicaid program, we have a number of different existing services that address health-related social needs. Our 1115 waiver from 2015 to 2020 conducted a very innovative pilot on providing supportive housing and supported employment services that were reimbursed for by Medicaid. A number of our MCOs have value-added benefits that provide additional services to address health-related social needs. And we know that from an adaptation perspective, these health-related social needs are going to continue to evolve. And so I'm just highlighting a couple of pieces here of our 1115 waiver application, which is currently in progress. We've put in a component under the health-related social needs services for environmental accessibility and remediation adaptations, including home modifications and including asthma remediation services. I'll just highlight that Oregon Medicaid recently received approval from CMS under their climate supports 1115 waiver portion of the program to receive reimbursement for air filters and air conditioners for individuals who have a demonstrated health need. I think it'd be really interesting to incorporate the same under these parameters. And then I'll just also highlighting community hubs, which the healthcare authority is envisioning as centers for community-based care coordination that focus on health-related social needs, and calling out that one of our populations of focus are individuals and family members that are impacted by local public health emergencies and adverse events, including adverse climate events. We know that the frequency of wildfire smoke and heat wave emergencies have increased even in the last few years. And so we're anticipating that in the future, we're going to continue to have to explore flexibilities to address these health-related social needs. On the next slide, I want to highlight one initiative that was focused on mitigation, and really excited about this collaboration with the Washington State Hospital Association. The Medicaid Quality Incentive Program has been a program that's been in existence for some time under the Safety Net Assessment Program. And one provision of this is that we provide a 1% incentive payment to hospitals on the performance of specific quality measures. And now many of these measures are your more typical measures with that you might think about in inpatient care related to catheter-associated UTIs, surgical site infections, in-hospital falls, et cetera. But in 2022, we baked in a more novel component that was a survey on climate change. And this was to get an understanding of the over 80, 90 hospitals in Washington State and understand what were people experiencing from a perspective of climate change and healthcare. And were folks working on sustainability practices to facilitate a transition to a more sustainable delivery system and to decarbonize. We found, again, this survey was conducted by the Washington State Hospital Association. And so just in case Kat Mazawi is in the audience today, really big shout out to their team that there were top environmental conditions facing hospitals included wildfire smoke and extreme temperature, not surprisingly, and that some hospitals were developing plans to respond to the impact on population health. There are many that in Washington that are already measuring greenhouse gas emissions, and this was really encouraging. We do know that there's a number of health systems and providers in Washington State that consistently receive awards from organizations like Practice Green Health. And I think that just demonstrates again how exciting Washington of a place Washington is to be for those that are really committed to climate action. Some common initiatives to implement sustainable practices include things like emergency management plans, HVAC upgrades, energy efficiency, and waste reduction. We know that the hospitals are also thinking about some of the rules that have been going into place that Red mentioned before. Our clean building standard is going to be applying, and so thinking about how to adapt and large facilities, hospitals of course have really significant needs in order to run the 24/7 operations that they do to serve the general public. And so thinking about how we make that and transition and incentivize it. The next slide.
Dr. Chen, we just have a couple minutes left. Do you want to go over this slide and then?
Yeah.
I think this is your last
so
slide.
just some key messages for payers and purchasers in the audience. I think there's a number of significant levers that payers can use to create a more sustainable healthcare delivery system, both to address adaptation, environmental justice, as well as mitigation, decarbonization. There's an alignment between fiscal and environmental stewardship that I alluded to before, plenty of waste and unnecessary care that we should be addressing. Along those lines, need to address misaligned incentives, invest in preventive care and primary care, to achieve more sustainable healthcare. So yeah, Emily, I'll just pause there and leave it open for questions.
Yeah, I actually had a question for you. So I know from interacting with you that you've done a lot of work to educate yourself on climate change and things. I'm hoping that you may be willing to share with the group today so you just spoke about your work at HCA. How have you taken upon yourself outside of your organization to promote climate action and to do some work personally to be able to support your organization in promoting climate action as well?
Oh, thanks for that question, Emily. I think I suspect there's a number of folks in the audience today who really care about this topic, you wouldn't be here if you didn't. I think that a significant message kind of hammered into folks around climate change is often focused on personal carbon footprints and recycling, taking more public transportation and changing energy usage at home, reducing air travel, for example. But there's a lot of potential when folks think about climate action and climate hope in the work setting too. So bringing climate action to work is certainly an avenue for folks to, Brad mentioned this is a really massive problem that touches pretty much every facet of human life. And that's really daunting on the downside. The positive side is that almost everything we do can help address climate change. And that includes kind of the work that everyone in the audience does on a day-to-day basis in the healthcare. So yeah, thanks, Emily.
Yeah, thank you so much, Dr. Chen. We really appreciate the opportunity to hear from you, and we'll bring you back at the end of the presentation. I'll now pass it on to Brad and Colin from Public Health Seattle King County.
Hi, can you hear me?
Yeah.
Great, thanks. I'm Brad Kramer. I'm helping to manage a climate and health equity initiative at our local health department, Seattle and King County. And then Colin will introduce himself as he talks about the more focused healthcare work the work we're doing with the healthcare sector. Start with a little bit of doom, but I want to punctuate with some practical action, and I'll talk more at the larger infrastructure level, and then Colin will talk to more specifics. But this slide, I don't know if it makes you react the same way it makes me react, but this is outside of our offices in Seattle, and just the sight of it brings back all of the feelings. And so we're not in person, so I'm trying to get you to ground in with me. But if you want to think about, this is a wildfire smoke event, maybe it's a heat event that you've had personal connections with, or maybe it's something that your friends or family have been experiencing. But this slide, I almost feel it on all five senses, and it comes back, and it becomes, you begin to really contextualize the health part of climate and health and health is now seen, or climate change is now seen as the biggest threat to health facing humanity. And so we have been addressing that at the health department. If you go to the next slide, I think, for many years. And so in this timeline, I want to show you, one, the long ramp up to doing this work, and then also the climate events. So along the top is a timeline of how King County has been taking action in climate change. More broadly, they introduced their first climate change strategy or strategic climate action plan, which I might say SCAP, is from 2015 to 2020, and then a more recent one. We have had a climate health action team of volunteers almost. I was coming from an asthma program which has experienced the early effects of climate change, and many others across all of our divisions. So this is really cross-divisional work across all of the pieces of a health department, and then how we got folded in. But I'll share those steps. But along the bottom, it shows how even along the way, as we became committed to dedicating staff to climate change, we were reacting to these events, and as they move from episodic events, we need to be more proactive. And we're seeing with wildfire smoke, it's no longer just episodic; it's consistent, and these events are more frequent, longer in duration, and higher in intensity. Next slide. So we took early action as our team of volunteers and a small grant. We were able to, and they're not volunteers, we were staff, but we were able to produce a blueprint. What does the health department do to address climate change, or what could we do if we were resourced? And I put this up here to say, I feel like there's some generalized pieces you can take from our work, no matter where you are in Washington State or wherever you're listening from. But we borrowed from reports. Your community may already have reports. We borrowed from Our People, Our Planet, Our Power, from Got Green locally, and the Seattle Equity and Environmental Agenda. But and then more recently, there's a statewide report from our Washington State Physicians for Social Responsibility. And so you might not be starting from scratch. But then we created this report, which allowed folks to sort of bring our agenda, or agenda is not the right word, but our actions into a broader context. And so next slide. So we went from being part of the planning process for the 2015 SCAP, or Strategic Climate Action Plan, to now being fully integrated into the 2020 Strategic Climate Action Plan. They could borrow from the blueprint, but what they did was they did a new section called the Sustainable Resilient Frontline Communities. And these were community determined or community driven solutions from a task force that was asked to oversee this work. And they called upon the county health department to do 70 actions, leading in some, supporting in many. And next slide. And so this is a flavor of that type of work that we're doing. We sort of put into 3 work streams. So one of the early calls to action was building a data monitoring system. So identifying some key climate and health indicators. All of the work we do is centered on our most impacted and frontline communities. And so partnerships and community leadership is another important work stream, and our communications lives in this as well. And then as the story of how we got involved also includes how the county has shifted from focusing on mitigation, reducing or slowing the impact of greenhouse gases on climate change, to adaptation. Now that climate change is here, what can we do? And that's where health gets called in more often, and leading in that work. And you can see they organize it in what looks like the social determinants of health, and how we do this work, focusing on food security, housing, employment with green jobs, and transportation. We've been called in to do some work in the other sections, but predominantly in these community determined solutions. Next slide. So I guess overall, before I introduce Colin, I'll say that the common strategies, I think, sometimes it takes a green team of volunteers. It can be a long process. Yes, it's urgent, but it may take some time. So doing small successes like the written report can be motivating. And then, but ultimately it takes leadership, prioritization, and resources. And we've been fortunate to have that. So now, this picture reminds me of that, there is climate change is despair, and eco-anxiety is real, but a solution to that is taking action. So I hope Colin is going to share with you some ways that you can take this to your work immediately.
Thanks, Brad. And so, yeah, I'm Colin Rhodes, and I'm a fellow working with Brad directly with the initiative for 1 year. And our work is focused on the healthcare sector. This is in response to a recognition that, there was kind of a gap between public health and health systems within the context of climate change. And so it was really Brad that kind of envisioned this scope of work, and then recruited me to help carry it out. And so I'll kind of outline what that looks like. Next slide, please. And so our work kind of touches on three primary focus areas that the other panelists have kind of addressed cumulatively already. So one is really looking at healthcare sector mitigation. So looking at ways to support their efforts to decarbonize and increase sustainability. Third is, or sorry, second is strategic planning, which is really we're trying to build some, and I'll discuss that in more detail in a few slides. And then third is really adaptation oriented. And so again, supporting health systems adaptation efforts, and then our own work at the health department as well, because as I think Rad, Chris, and Brad all kind of outlined, climate change is here. We're already feeling the effects. And so as much, as important as mitigation is, I think in some ways it's even more critical, at least from a public health standpoint, to really increase our depth and breadth of work within adaptation. Next slide, please. So when I first came on in the last fall, Brad, I really wanted to kind of get a grounding in the healthcare sector, because it's both a major contributor of greenhouse gas emissions that others have touched on, and then also just plays a critical role in treating those people that are impacted by climate change effects like extreme heat and wildfire smoke. And so on this slide, it provides kind of a summary of exactly what that contribution is. And so you can see it's around 10%, close to 10% in the US. And this is, I think, another key point is that it's increasing. This is a sector that the emissions continue to rise. It's similarly to healthcare expenditures. We have the highest per capita greenhouse gas emissions from the healthcare sector in the world. And I think as Chris touched on, most of this is in the supply chain, as you can see that graph at the bottom there. And so, those emissions are dispersed through such a wide range of sources that it can be difficult to address. But next slide, please. And so, excuse me. So I really looked at, those, major national health systems that have been awarded by Practice Green Health and Healthcare Without Harm and others that Chris had mentioned, and really wanted to look at the patterns of those health systems that were leading on sustainability and climate change mitigation. And so some commonalities were that they had made a real commitment or a public organizational commitment to reduce their greenhouse gas emissions. Many had signed on to the White House pledge of reducing 50% by 2030. And then, I think along with that was a real organizational commitment was, really having strong internal structures like green teams that were both clinical and non-clinical in nature, and staff to really push forward the work. And the bottom part of the slide here, there's also some common actions that they took that Chris kind of outlined some of these, but you can see there's some low-hanging fruit in terms of LED transition, reducing waste. Some of the more aggressive measures that health systems have successfully completed have been things like phasing out desflurane and other extremely carbon-intensive anesthetic gases. And one local example here is Providence Health System achieved that. And then in almost all cases, those systems that really moved aggressively have made significant reductions in overall costs. And that may have, been over a period of years, but they also reduced their emissions and then, reduced their waste. And next slide, please. And so the second area that we've been working in is really trying to integrate consideration of climate change into the community health needs assessment. And for those who may not be aware, this is a requirement under the Affordable Care Act that every nonprofit hospital must complete a community health needs assessment every 3 years to maintain their nonprofit status. And it really, especially in major cities, but everywhere, kind of really identifies and kind of sets the priorities, and that helps guide where resources and programs and services are allocated for that kind of 3-year time span. And next slide, please.
Hey, Colin, we just have about 3 or 4 minutes left, okay?
Okay, sure, thanks. And so, as I mentioned, it really hasn't been climate change has not been widely integrated in community health needs assessments. Nationwide, it was really only maybe 3, even out of those, leading systems I looked at, only 3 had developed indicators or narrative. And so there's a broader team within public health that is working on integrating consideration of, extreme heat, air quality, and associated impacts on health. And so that will be happening for the upcoming 24 or 25 edition of the CHNA, which will be finalized at the end of this year. Next slide, please. And then a third area that we're working, as I mentioned, is adaptation. And I think I really appreciated Rad's focus on climate and environmental justice, because really is direct connections between those populations that are already experiencing many health disparities and inequities and those that are at disproportionate risk for climate change effects. And so within the broader initiative, we really worked in 3 areas: risk communication, distribution of box fan filters and protective equipment, and then doing some provider education. And so next slide, please. And so this is just an example of some climate change and health comics that members of our team partnered with local artists to develop. And these were, as you can see here, they're beautifully done and printed in multiple languages. Again, they're representative of those communities that are at disproportionate risk. And then we're just thousands and thousands were distributed all over King County and variable, both digital and physical formats. Next slide, please. And then also there's another area of our team that is really focused on distributing thousands of box fan filters to especially low-income residents, those that have asthma or children with asthma. And then, as Chris touched on, Oregon has a very unique and pretty incredible Medicaid waiver program that's opened up a whole significant resources to support climate change and health related equipment, like even beyond box fan filters, AC units, generators, things like that. Next slide, please. And then finally, the third area is, just recognizing that healthcare providers are some of the most trusted messengers. And so it's critical to make sure they have a grounding in the climate change, impacts of climate change on health, those groups that are most at risk in terms of patients and members, and then providing some resources directly to patients so that they're aware of what ways that they can protect themselves and their families from those health impacts. And so I think that's the last slide for me, and we can shift to Q&A.
Yeah, we'll welcome any questions into the Q&A box. And while we get those, I have kind of a 2-part question for you and Brad. A term you were using was a green team. That's a newer term for me. Could you provide more context to who is usually a part of these green teams and how do you begin them? And additionally, because the answer could be green team, where is a starting place for healthcare systems like hospitals and health clinics when they decide we want to do better at addressing climate change and within our own section, like our own organization? What might be one first step they can take?
Yeah, that's a great question. And so for the first part of your question around green teams, these are usually teams of interdepartmental staff, so both clinical and non-clinical, that are formed specifically to design and implement sustainability and climate change mitigation related initiatives within a health system. So an example would be bringing staff together to do things like reduce the use of single-use medical devices in clinical care, and so that would require a variety of staff to implement that, from procurement, purchasing, to the clinical side, ensuring that wouldn't, to figure out how to make that transition in patient care. And so it's just, I think, as Brad kind of touched on, it's such a climate change touches so many different areas simultaneously that you really need teams that have a wide range of expertise when you're trying to develop programs to address climate change. And in terms of some initial steps for those health systems that are looking to maybe move into sustainability or increase their actions within sustainability, I think the first step is really starting to, formally talk about it at an organizational level, engaging your departmental or senior leadership in that. And I know that Rad and I think Chris both highlighted Practice Green Health and Healthcare Without Harm are two great resources to support taking action on sustainability. They both have a whole range of downloadable free resources. They could also, I think some of these are behind a paywall in terms of having to be a member, but you could also connect with health systems that have taken action and are leading on that. And actually, Brad and I are in the process of creating some products that we're calling them products, but ones that we'd like to offer to health systems that kind of outline just that, some initial steps, some recommendations from our conversations with leading health systems that we're hoping to roll out this year, and that we could potentially send out to those that are interested. And Brad, I don't know if you have any additional thoughts on either of those pieces of the question. But.
No, I think that's a good summary. And it can start anywhere. Oftentimes hospitals will have it in their sort of, what's the word for that? Facilities and managers. But then also there's so much action that is climate work that's coming out of our community, the community needs sections of hospitals. And so it's been really great to talk to both departments and have them talk together. And sometimes it's for the first time. And so, we're still learning in that, and hopefully we'll be sharing those learnings.
Yeah, thank you both. I'll now invite the other panelists to turn on their cameras and join us again for panelist discussion. If anybody has questions for our panelists in general, please put those in the Q&A box. But kind of going off this question that we just had with Colin and Brad, there's a participant who asked, how can we mitigate the 82% of the contribution from healthcare, especially as this is increasing over time? What are the exact actions that need to be taken? Do you guys have any examples of that?
I mean, I think we gave a few, and then also, and I'd be interested if Chris has some examples, but I will say that Practice Green Health, which is already the example Colin gave, is as you become a member, and we just joined as an affiliate member, and so we've only recently got access to the resources, but they have a lot of resources that really talk about how to take action in sourcing materials and reducing waste in daily operations of the hospital setting or healthcare setting. And so becoming a member often gives you more resources and some consulting pieces, but a lot of this is free. The toolkits are online. So we've been working to contextualize it locally, but Chris, maybe you have some thoughts. I don't mean to put you on the spot.
All right. Yeah, no, thanks, Brad. I agree with all that. There's some really great resources out there. I think a really critical component of all this, and I hesitate a little bit to say it's a starting place, because I think a lot of times we kind of tend to get stuck in analysis paralysis when we start with the data. But it is really important to continue to push forth and understand what are the sources of waste and the significant carbon footprint in the healthcare system. Healthcare, as everyone knows, is incredibly complex in the United States. There's some interesting decarbonization work going on around the world. Rad mentioned that Canada has a number of commitments, both more broadly as well as specific to healthcare. The National Health Service from the United Kingdom is also very much a front runner. And I think, I mentioned those because when you start with the measurement and the data, it does lead to some surprising conclusions. I was surprised in one of the NHS's sustainability reports that about 3% of their overall emissions as a health system were attributable just to inhalers. And that was about as much as all the commuting done by NHS's the tens of thousands of staff, about as much as the emissions from their buildings. And specifically this issue has to do with the fact that meter dose inhalers have a propellant that is significantly more heat retaining than other molecules, and that just by transitioning to dry powder inhalers, they could save a significant amount of carbon emissions. And so I think, that's a data-driven insight that is really important. I think it'd be great for us to really lean into measurement. Absent that, there are lots of strategies that are out there that even without measuring, we know that lead to immediate action, such as some of the examples mentioned today, reuse of medical devices, reduction of waste, others like energy efficiency, chemical waste reduction, even food and procurement and facilities. So yeah, lots of work to be done.
Thank you. I have another question that was coming in was, as Rad mentioned earlier, and a couple of you mentioned, like the idea of doom and how talking about climate change and climate action can feel kind of gloomy and scary. And when you're going outside and just seeing that smoke impact and different things can be kind of it cause some anxiety as well. I'm curious within this whole process, like how do we stay engaged, optimistic, positive, and trying our best to move forward, and especially with ourselves, but for individuals who are on the call that might be parents or have family members that may be at a higher risk for a health issue related to climate change. How do you guys stay positive, or like how do you do that? Or any recommendations for that?
I think the way that I try and frame it for myself is that when we adapt to we have to change so much to adapt to climate change. And it's, instead of looking at it as a burden, we have an opportunity to remake some parts of society in a more just way. Like we can have a better world by the process of adapting here than we currently have. And just looking at things like, the Clean Energy Transformation Act, or, moving to clean energy, the air quality benefits to that are, pencil out just economically, even if climate change wasn't real, the co-benefits of doing all this stuff can be huge, and the opportunity to make a better world in the process is also huge. And so that's where I see hope, is like we're not just suffering under the pressure of climate change, but we are being forced into a place where we have to make some change, and we have an opportunity to make some change for good or better. But I also get depressed about it too. So it's a cycle for me.
Yeah, I would agree with that. I mean, I think there's no sugarcoating it. It's, the biggest emergency of our time, and things aren't looking good. I think, Brian Cheeseborough from Providence often talks about solastalgia, which is, this phenomenon around climate anxiety. The Healthcare Authority, as I mentioned before, covers a significant proportion of the state of Washington, and a significant population of the kids. And they're who I'm really worried about. they've got the longest time to live on this earth, and just kind of thinking about the behavioral health and the behavioral health crisis that we're already in with youth, and the need to expand capacity and access to address that, as well as talk to them about the changes in the world around them in a way that doesn't just kind of lead to despair. And I think that I'll just point folks to Howard Frumkin from our very own state of Washington, a faculty member at the University of Washington, who talks a lot and talks really eloquently about climate hope, and kind of differentiates climate despair from climate hope. The fact that climate despair doesn't lead to action, it leads to inaction. And all the biggest things that have come out, all the biggest advances in progress in society that we've made have come out of hope. And hope doesn't mean approval, and hope doesn't necessarily mean just thinking that everything's going to be okay, but it does kind of spur folks to take action, and think about what you can do in your own realm to address things.
And if I may, because this is important, it's important to maintain this hope, and so I want to take a little more airtime on it. But we are positioned as in health to. I think health could be a great unifier in this conversation, and has it shifted from an oceanographic and an atmospheric issue to an environmental issue, and now I'm saying it's a health issue. And in many places I walk in, while we've been talking about health and climate change for decades, and if I said it's a new to the conversation, people would disagree, but in many places I walk into, they wonder why health is there, and it feels new to them to be part of the conversation. And as Brad emphasized, there's co-benefits, and some of those are immediate, and once we point them out, they become obvious, and that can unify the conversation around the value and goal, and motivate and add to behavior change motivation. And so everyone on this call probably has a position where they are talking to patients or in somewhere in healthcare where they are seen in a trusted role. And so we have a great opportunity to begin to take those actions. And I already introduced Colin by saying like the solution to climate despair could be actions. And so I do think making these more action oriented and centering on those health co-benefits can be very motivating to the individuals taking those actions as well.
Yeah, thank you. I think I have a question that kind of goes off that, and I just want to make sure that we've answered this appropriate or fully within this webinar today. As I discussed with the panelists previously, I'm a clinician. I came to the foundation with a background in nursing, and I have completed quite some years of education, and I don't feel like I was ever taught about climate change and taught about how climate change and pediatric asthma and all of these health concerns that we're seeing, some acute and some chronic health conditions, trace back to climate change or are worsened when different events are occurring within our area. I'm curious to know, like, how do we begin to how do clinicians or individuals who are working within the healthcare system, what steps do we take and can we take to become educated on this so we can understand that connection piece so we can take action? Are they the resources that you mentioned earlier? Are there other resources? Like, if we're in the stage that we're wanting to do something, where do we begin that process?
Yeah, I'm sure everyone else will have additional thoughts, but I can take a first stab in that. The nice thing is that I feel like the knowledge base and the resources have started to catch up with the problem. And I think that was lagging for many years. There just wasn't, it was happening, but there wasn't, people weren't being educated, there weren't accessible educational resources out there, but now there are. And there's a whole, there's many that range from being provider or health professional focused to a broader non-clinical audience. And so there's a great free self-paced e-course that was developed by Harvard University called The Health and Effects of Climate Change that anyone can take, and you only have to pay if you want to get a certificate or something. But I did it myself. It's about 7 hours or so, and it gives you I think a really good grounding and expanding on many of the things that we talked about today. There's several, there's AmeriCares, which is another Harvard partnership, developed climate resilience for frontline clinics toolkit. So these have tons for those that are clinicians. They have many resources, downloadable PDFs that are developed for clinicians, and then they have many resources that people can just print off and give to patients that have recommended behaviors for wildfire smoke events, for extreme heat, extreme weather events. There's the Public Health Institute has developed a physician's guide to climate change, health, and equity, which is again another clinician focused but very comprehensive instructional document. And there's many others. And so if people are interested, I've put these and others on kind of a reference sheet that I think Emily is going to circulate with our PDFs after this session, but that might be a place to start. And I'll shut up so others can chime in, because I'm sure there's other resources out.
Yeah, and thanks, Emily. I was just going to also add, in addition to those really excellent resources, I think always, for clinicians, lifelong learning is very much a component of our practice, and I think just talking about it in the clinical setting with colleagues, with patients, can be helpful. And some of those initial conversations may be a little bit more awkward or kind of more exploratory, kind of in the discovery phase. But I think as we, as a profession, as an industry, as a society, normalize the conversation around climate change, we all learn together. And I think it's really important for us to be able to talk to each other and learn together. And yeah, just adding to some of the Colin's resources, I really like the University of New Mexico Project ECHO on climate change and human health. A little bit hard to find. The link is about halfway down the page, and you have to click on a PDF document. Not a knock on the program, because really great resources, but would highly recommend that. Some really renowned experts speaking, including some of those that we referenced today. And then also out of Columbia, there's the Global Consortium on Climate Change and Education, and that has a real significant focus on the health profession for clinicians and educators to think about how to develop a vocabulary to talk about this more.
Yeah, and I agree with Dr. Chen on starting those conversations. And maybe one thing that helps me think about starting them is like Yale Center for Climate Change Communication has been doing their 6 America study, where they've been asking people about their views on climate change over the, maybe the last 10, 15 years. And in the last decade, the number of people who are alarmed about climate change has tripled. So the number of people who think this is a problem are growing, and and people often think, that there are fewer people who have shared their views on climate change than there actually are. So the data suggests there's potentially more people out there who also are thinking about climate change and want to talk about it than you might expect. So you might be surprised once you start those conversations.
And those climate conversations, whether they're like a climate lunch or a sidebar conversation that you're having, that's how Green Teams gets formed. So and that can also be your healing space when you need to talk about your climate anxieties, just to weave together some of those points.
Thanks, Brad. I'm going to do one more question. If I'm hoping we can answer this quicker. Is somebody asked, do we have any data if the use of telehealth has reduced healthcare carbon emissions during the COVID years? Would this be something we should expand more? Is there knowledge on that published yet?
I'll just, not that I've seen. I wouldn't be surprised. I think there are folks who have a hard time accessing specific kinds of care in rural areas that have to take transportation of various forms, to whether it be within the state and driving, or across states and flying. And so I think that certainly is a hypothesis. I'll also add, a lot of the conversation around telehealth is about kind of equivalence to in-person care. And I think we're still in the early phases. It's only been 3 years since the pandemic, and we often don't see kind of big studies and evidence about telehealth, about topics in medicine until further out. And I think telehealth really, there's definitely places that it works well. And there's some places where I personally am a little bit more concerned. And so, and in that case, you know, if telehealth is being applied in the wrong place, then, you know, it's just another kind of unnecessary measure or things that lead to further complications. And so I think it's probably really difficult to make broad statements about whether or not overall, but I think certainly in specific use cases, it definitely can reduce carbon emissions.
Thank you. So I'm looking at the time. We wanted just to provide some closing information to the participants on today. We're going to put some links in the chat for all of you. We do at the Foundation for Healthcare Quality have a couple events coming up if you'd like to participate. I think you can see my screen. One of them is on Thursday, June 1st at 12 to 1:30 p.m. We're having another webinar on the exploring the complexities of real data, so race, ethnicity, and language data, and understanding kind of how are we going about tracking that and looking into that information. We also are working on developing an equity action collaborative that's beginning this spring and hopefully next month. If you're interested in learning more and participating with us, you can contact us via the BRE email. This is to help organizations move from a health project plan into hopefully being able to implement some project work in their own settings. So we're excited to begin that. And then we also have a link to our listserv so you can stay up to date on all the events that we're leading here at the BRE Collaborative and the Foundation. We want to take a moment to thank each of our presenters for working with us today and being with us today and sharing their knowledge. And we're also grateful for everybody who stayed on to participate in answering questions. Thank you all so much, and we're really grateful for you being here.
Yeah, thank you, everyone.
Thank you.
Yeah, thanks everyone.